Sawasdee krap. Good afternoon. It's actually late afternoon right now, so it's the 1st of August 2021, Sunday the 1st of August 2021, and this is the English language summary of the CCSA Daily Press Briefing. Today we have a briefing because the Prime Minister Prayut Chan-o-cha chaired a general CCSA meeting this afternoon in order to talk about the additional measures that we have to implement because of the situation of COVID in Thailand. Now, I'd just like to recap that in a short while. Dr. Pisamai also recapped that, highlighting very important issues, the salient points of this meeting that we had just now. The meeting actually just ended in less than an hour ago. So the Prime Minister was reported on the various efforts to receive vaccines in all of the negotiations for vaccines. And that will be, of course, expedited. And the priority group in Thailand would remain the medical personnel, those in the front lines, as well as all the other groups that we have laid out, including, of course, the general public as well. So the use of the antigen test kit, the Prime Minister stressed, that has to be used in a very precise manner within the procedures of using the antigen test kit, and it has to be linked with medical personnel assistance, as well as in terms of the pricing control as well as the quality. Another issue which the Prime Minister highlighted was about the increasing infection in factory areas, the transition of campsites, from worker campsites to the various communities nearby. This is quite prevalent, a high level of prevalence. So the Prime Minister stressed on the enforcement issue as well, the enforcement of the bubble and seal approach in various workers' campsites, the application and enforcement for the efficiency of the bubble and seal scheme in the various campsites. And of course, increased surveillance will supplement the bubble and seal strategy. There had been some issues in the bubble and seal strategy, and the increased surveillance and increased monitoring of these campsites will augment and support this containment of COVID, particularly in workers' campsites. And also, the medical personnel in our meeting also discussed about the use of the various vaccines in terms of the communities around the country, and the concern was also about the assembly as well as gathering of people in large numbers. The Prime Minister was concerned about the spread of COVID in these situations as well. So these are some points that the Prime Minister raised, but for the results of the meeting itself, I'll come to that in a short while. Firstly, I'll talk about vaccination progress as usual. The update on the number of vaccines that have been administered since the start of our national vaccine drive. Yesterday, Saturday, we had 194,342 doses of vaccines administered, increasing the accumulated number of vaccination in Thailand to over 17.6 million doses. And starting today, the Health Ministry had adjusted the distribution plan by providing vaccination services to people aged over 18, so actually the general public, and those afflicted with any of the 7 underlying diseases who registered in advance. So as you can see in our national vaccination plan, it has been increasing in terms of the groups of people being administered. First, it was the priority given to medical personnel, of course, frontline workers, those 60 years old and above, and those with underlying diseases. And now, of course, to the general public, those over 18 and above. So many of you may have heard about the news about this same prioritization, expansion of prioritization to the general public. Many of you have heard that this applies also to foreign residents in Thailand. So that this was something that we announced yesterday. The CCSA approved the allocation of 150,000 doses of U.S. donated Pfizer vaccine to foreign residents in Thailand. So this was part of the Pfizer lot, which was donated by the United States, and 150,000 doses had been set aside particularly for foreign residents in Thailand. And starting today, the Ministry of Foreign Affairs, in collaboration with the Ministry of Public Health, had launched the new online platform for foreign residents in Thailand to register for the first dose of COVID vaccine. Of course, for those who have not been vaccinated at all yet until today, this is the portal that we have created. This platform, expatvac.consular.go.th, is open for registration for foreign residents of all ages nationwide. So if you're a foreign resident in Thailand, living anywhere nationwide, this portal is for you. If you recall, the scheme prior to this in Bang Sue Grand Station was for those living in Bangkok and the surrounding areas, and also 60 plus. Now this one is for the general foreign resident population and around the country as well. So the Foreign Ministry, in collaboration with the Health Ministry, will arrange this vaccination for those who registered in this portal, with priority given to vulnerable groups based on the same criteria for Thai nationals, that is, elderly, pregnant women, and those with underlying chronic diseases. This is just the priority in terms of the appointment, but the opening of this registration is open to foreign residents of all ages and living in any province in Thailand. And registered foreign residents will be notified of the dates and the vaccination sites in accordance with the level of risk and location of residence. So it would depend on what the Ministry of Public Health would be assigning in terms of the location of the vaccination. Foreign residents aged 60 to 74 who previously registered with the Foreign Ministry's platform, this was for the Bang Sue area, will have their records transferred to this new website and will be directed to the vaccination site. And you see on screen now, if you go into this website, expatvac.consular.go.th, it'll have this page as well, which actually covers all foreign residents. You see all the three boxes which you can press on which category you are in. And of course, on the vaccination date, you have to bring all the official documents with you. And this morning when we opened this portal at around 11, there had been some minor glitches to the website. We apologize for that difficulty in registering because many people were registering at the same time, but that has been taken care of already, and many have been successful in registering in this portal since already. Right now, the information that I had at around noontime was around over 20,000 foreign residents had already registered for this in this scheme, in this portal, and towards the late afternoon, it was around 40,000 already. And the Ministry of Public Health will announce the details on this procedure. On the procedure for other groups as well, which include Thai students who have to go abroad or athletes who are scheduled to go to international tournaments abroad. So this is one of the last groups that will be addressed in terms of the vaccination for those relating to going abroad. Moving on to the general situation, a number that we have for today. Yesterday and today we have a new high. New confirmed case is 18,027 cases. The active cases still being treated at the moment stands at 205,002. 205,000. We have new recoveries, which is actually a new high in terms of new recoveries as well, at 13,402. You can notice that the new confirmed cases for today and yesterday and the past week had been quite high. We have new fatalities at 133, making the cumulative total of fatalities in Thailand now standing at 4,896. This is a 0.81% death rate. Now, notice that the fatality rate in Thailand for this day, for example, for the past day, for example, had been concentrated on the elderly, as well as those with underlying diseases, as well as those who had not been vaccinated yet. Now, due to the rising infection rate in Thailand, the CCSA, when they had the general meeting this afternoon, would be announcing the tighter disease control measures. And these tighter disease control measures, finalized today already in the general meeting, would be effective from Tuesday, the 3rd of August onwards. So that would mean effective on the night of Monday, the 2nd of August, midnight, the night of the 2nd of August, being effective in the early morning of the 3rd of August, 2021. And of course, this will be evaluated every 2 weeks. Usually we evaluate every 2 weeks, so we have 14 days to evaluate this, but possibly this will be extended until the end of August. We'll have to see the situation then. Now, the tighter measures that I'm talking about, we'll have some infographics on screen for you. Firstly is the recategorization of zoning areas in Thailand. If you recall, we had the dark red zone, which is the maximum and strict controlled area, Bangkok and nearby provinces, 13 provinces to be exact. From the 3rd of August, this Tuesday, this group has been increased in terms of the number of provinces. So from 13, it is now 29 provinces. For the orange zone, we have on screen for you there's an adjustment there as well. A fewer number of provinces because some moved up to be in the darker red zone. And the orange and yellow, you have the changes there. So what's most important is, of course, the maximum and strict controlled areas, or the dark red zone, which you see on screen now, is the new list of the 29 provinces in this zone. The provinces which are currently most affected. I won't read that to you. You can find that on the social media pages of the CCSA. And these provinces have been increased to 29. And not only provinces that are nearby Bangkok already, but mostly in the central region, as well as those in the southern region as well. Yes, and you see the dark red, red and orange on screen there. Now, aside from the recategorization of provinces, the meeting today also came up with some changes in terms of the restriction to contain COVID transmission. So we have an infographic there on the full screen for you, just to highlight some of these points on screen for just a minute here. So for the maximum and strict controlled areas, we have some changes there. Firstly, it's that the restaurants in shopping malls, if you see the column in the center, shopping malls, the restaurants in shopping malls can open, but only for delivery services. So previously in Bangkok and the surrounding areas, the dark red zone areas, the restaurants in malls were closed. Now they can open, but particularly for delivery services. And of course, these malls, the supermarkets and pharmacies can open until 2000 hours. That's in the middle column there. Now, if you move back to the first column on the left in terms of travel restrictions, just to highlight the dark red zone, curfew remains at 2100 to 0400 hours, but no public transportation services across provinces in the dark red zone are allowed. The second column from the left, you have the restricted activities. Dark red zone it says no public gatherings of more than 5 people. And the red zone, maximum controlled, has it as no public gatherings more than 20 people. And in the yellow one, no public gatherings of more than 30 people. So just some highlights of this chart that you see on screen. And of course, today, in the earliest opportunity, this will be formalized and announced in the Royal Gazette. The curfew in the maximum and strict controlled area, or the dark red zone, just to stress again, remains at 2100 to 0400, which is 9 p.m. until 4 a.m. and the other restrictions that I mentioned. And the good part of this change is that shopping malls will be able to open for takeaway service. Also, with regard to provincial measures, just to highlight that following the example of Phuket province, Phang Nga province also announced in its provincial order, which includes the closing of its borders to the general public, in terms of domestic general public, from the 3rd to the 16th of August 2021. This is for Phang Nga province, following suit with Phuket. Entry to the province by land, air, and sea domestically is prohibited. And exceptions to this ban on entry includes ambulances, transportation for medical supplies, important appointments like court appointments or people on official business. And people entering this province must also be vaccinated and have proof of a negative COVID test within 72 hours prior to arrival. And locations that may pose risk to spreading the virus, such as internet cafes, game centers, theme parks, pubs, bars, will be closed. So schools will also be conducted online. So basically, this is what I have for you today, just to recap that all of these measures, these new measures from the meeting today, will be reviewed in 14 days after today for continuation or for any adjustment. Possibly, depending on the situation, it may last until the end of August. So thank you very much. With that, I thank you very much for your kind attention. It's a Sunday today, and we had an emergency general CCSA meeting, which was very timely because, as you know, the 14-day limit that we had from the last change adjustment in terms of the measures would expire on tomorrow, on Monday, the 2nd of August 2021 already. So today's meeting recapped and evaluated what had to be done, what was necessary to keep the measures in place, the strict measures that would help to control and contain COVID with all our many efforts. So we have gone down to campsites, made adjustments. We have talked about the shopping malls. We talked about ATK, antigen test kit, bubble and seal. Provincial measures like Phang Nga had been adjusted, and the like. So hoping that our efforts will bear fruit in 14 days after today. With that, I thank you for your attention, and we'll see you again tomorrow. สวัสดีครับ
ครับขอบพระคุณนะครับท่าน